My name is Portia Menalawan, student number 3030882. The purpose of this video today is to do a patient teaching for my client, whose name is TC, and has suffered a stroke. He's been in the hospital for a while now, and he's going to be having a patient discharge today. His blood pressure is at 192, 194/108, and the patient teaching is on diet and lifestyle changes. I'm going to be using the Canadian food guide, and I'm going to be teaching my client here today. So can you please sit here? Thank you very much. And this is Mr. Alberto Menegon. He's going to be my patient today, pretending to be my patient. I will begin by performing hand hygiene for myself and my client. And I will provide privacy, and I will introduce myself. My name is Portia Menegon. I'm going to be your student nurse today. How are you doing today?
I'm good.
Okay. And I'm going to identify the patient with two identifiers, the name and the handband. Can you tell me your name and date of birth, please?
My name is TC. My date of birth is 1975.
Okay, thank you, TC. Thank you, TC. And TC, the reason you're here today is for patient teaching. You've been in the hospital for about 3 weeks now, and it's time for discharge. And we would like to educate you on diet and lifestyle changes that you can use to control your BP in addition to your medication. Is that okay?
Yep.
Okay, good. And yes, TC, I have my laptop here with me. It's just to guide me, and it's for both of us. You can take a look at what I'm teaching, and feel free to stop me at any time. If any question, there's no question that is off limit. All questions are welcome. And if you don't understand anything, let me know. And here with us today, imaginary, TC's wife, for support, and I'm collaborating with the dietitian and the physiotherapist. And for the purpose of in real life situation, this teaching will be broken down in 3 sections, but for the purpose of this video, it's just going to be this one video. Okay. So TC, here I have information about food, diet changes, and lifestyle changes that you can imbibe to control your blood pressure. So what do we mean by unhealthy diet? When we say unhealthy diet, it means when you consume too much fat and too much salt, sugar into your body system. And when that happens, when we take too much fat and sugar into our body system, it does a lot of harm to the system. The harm it does to the system are, it can lead to high blood pressure, it can lead to diabetes, it can lead to high cholesterol in the blood. Cholesterol means the bad fat. It clogs the heart, the arteries, and blood does not flow all over the heart and makes the heart work faster, causing hypertension, work harder. And if I'm too fast, please slow me down at any time, okay? All right, so yeah, it causes heart disease and some kind of cancer. Also, it can make us overweight, right? And yes, so those are the downsides of unhealthy eating. But there is a good side, and the good side is with eating healthy. What do we mean by eating healthy? We mean eating less sugary food, and an example of sugary food could be pop, sugary drinks could be pop, taking a lot of sodas. Yeah, so we can take less of that. That's healthy. Take it out of our diet, and take more food that are high in protein, in fibers, in whole grain. Here I have a picture of the Canada Food Guide. There's a picture of the Canada Food Guide, and sorry, it's in black and white. And here, one for you, one for me, and I'll give a copy to your wife who is here with us. And in the Canada Food Guide, here I have highlighted all the vitamins and nutrients you're to gain if you switch to a healthy diet. I'm also going to give you this copy, and this is what we're going to be basing our discussion on today. So yeah. And before I move on to this Canada food guide, I want to tell you what you will gain when you eat healthy. You will lose weight. Like you'll be able to burn fat if you eat healthy. When you eat healthy, you have the energy to fight diseases, to fight infection from your body. You have vitamins in your body. You have calcium, magnesium, potassium in your body. What do these things do? Potassium helps in the muscle contraction of your heart. It helps your heart to squeeze out blood in the normal capacity through your body. Okay, so yeah, so that is what we're saying right now. And yeah, I hope I'm not too fast for you. Okay, good. So when we are fighting things that affect our health, like high blood pressure and stroke, when we're fighting these health diseases, we do not use only medication. We apply the use of good diet, healthy diet. We apply the use of exercise. And in combination, these things help to bring down the blood level and to increase our quality of life. So we haven't talked about food. Do you have any question on food for me? Okay. So one last thing about food. There is a Canada food guide here, and we see a plate, like a round plate here, and half of the plate here to your left is packed with vegetables and fruits. In this portion, you can have potatoes, which Alant you like. Am I correct? You like potatoes? You can have it here. There are apples, there are broccolis and berries, strawberries, and all that stuff on the one half of your plate. And what do these things give us? They give you vitamin A. Vitamin A is good for your eyes. They give you fiber. Fiber is good for, to help your metabolism. And potassium. Potassium is good for your muscles, helps your heart contrast. And yes, you see those very nice things, which are very useful to you. On the right hand side, 1/4 of the right hand side, you have all the protein. Your steak can be there, you don't have to throw it away. And you have eggs and beans and nuts and legumes. These things are good in vitamin B. Vitamin B helps you to fight diseases. Yes, and it helps for your brain health. It helps to fight infection. And you have iron. Iron is in the blood flow of the body. And you have magnesium. And on the left bottom, the other quarter of the bottom, you have bread, pasta, crackers, cereals. And these things are packed with iron, with fiber, and with vitamin B. All good and nutritious for your body. And your choice of drink always should be water. I know you travel a lot because you drive. Just you can prepare a meal from home, and you take it along with you on the journey. And alongside, you can, instead of packing healthy snacks, you can pack things like celery, things like carrots. Carrot is good in fibers, very high in fibers. You can pack apples and berries. Your choice. There's a wide variety. Just pick healthy fruits, and so you're able to control the blood pressure and your heart condition. Okay. Any questions so far?
No.
Okay. So let's move on. And did you understand what? So can you tell me one unhealthy food that is not good for the body?
Food that contains so much salt, so much fat, so much sugar.
Okay. Oh, like pork.
Yeah.
Yeah. Okay. For sure. Okay. Can you tell me one disease that unhealthy eating can cause?
Okay. Stroke, high blood pressure, and what again? overweight.
Yeah, you asked for one and you gave me three. That's good. And can you tell me one good reason why we should eat healthy?
Oh, so I can stay alive.
Oh, good. And have a good quality of life too. Good. Thank you for listening. Okay, we're going to move over to exercising here. That is changing our lifestyle. From you know you drive hours. So when you're on the road, you can take short breaks. Come out from your vehicle or your truck, walk around for about 10 minutes, stretch your legs, stretch your hands, and go back into your truck. When you stretch your hands and stretch your legs and walk around, it increases the blood flow to the whole of your body, including your brain. And when you exercise a little, it burns the fat it burns fat, and thus it's reducing the level of cholesterol in your body. And it makes your heartbeat go in the normal pace. Mm? And this time around, your blood flows well, and we're able to drop the heart rate to the within normal range. Good. Also, exercises, they strengthen you, and they help improve your mood. And and examples of exercises you can do is walking up and down the stairs. You can use dumbbells between 2 to 10 kg, just as tolerated. Though if 10 kg is too much, please 2 to 5 is fine. And yes, you can walk up and down the stairs like twice. You can go for strolls and walk with your wife or your dog, if you have one, or any pet you have. So anything that is stressed to, as long as you move your hands, you move your leg, you're burning fat, yes, it will work, and it helps for your cardiovascular system, which is your heart. So that is one or a lot of good things that exercise can do for you. So at this point, I'd like you to ask me any question if you have it.
When you spoke about diet changes, I was a bit skeptical, afraid that I'm going to lose eating the potato and the steak that I love, but from what you explained, I can see that yes, there is potato here. You only said I just need to reduce the quantity, and I can have steak over here, reduce the quantity, and then bring in some other stuff. So
Good.
that's good.
Thank you. Yeah, the key here is making small changes every day. Small changes every day. Consistency. That is the key. Be consistent with the changes. And lastly, on this teaching, I would like you to rest more. I know we have to make money, yes, but rest is very important. It takes away stress. It brings down our blood pressure level. The BP will go down gradually. Rest. When you're driving for 2-3 hours, find a safe spot, park, and take a quick nap. You'll be surprised what it can do, even for your brain, for your mood, for your energy level. And when you do get home from your trips, please take at least 8 hours to sleep. This also helps to bring down your blood level, your heart rate will not be beating so fast. Definitely your body is resting, right? And yeah, it helps to reduce anxiety. Yeah. Then that being said, that's it for our teaching. I will be following you up. I already have your number and your permission to follow up on these teachings, and if you have any questions, you can also call us in the hospital. Okay? Yeah. So you have any questions for me at this time?
No.
Okay. So, and I've already talked to you about this thing. So tell me one change you will make in terms of lifestyle change to improve your health.
I think I just need to incorporate exercises into my daily routines. Yeah.
Okay. Thank you very much, TC, for your time, your patience, and your attention. And I wish you the best. And yes, that's it for my video today. And thank you very much.